Talk a bit about penetration and the fact that the penetration of health insurance is put at about a paltry 2.85%, some say 3%. Do you think measures such as this will help this situation be resolved? Do you think we will see an increase in penetration?
I think what we are doing is that we are building a huge risk pool, and that is the best way of going into the health insurance, especially from a private point of view, because this is almost like a quasi-private initiative in the sense that you're putting together people who are already having a regular income, dependable income. If you do that, then that is how you're going to bring in other pools. If you look at places where healthcare has been able to grow, like in Zimbabwe before the collapse of Zimbabwe and South Africa,
yes,
they had organizations called medical aid scheme. And medical aid schemes were no different from what the government is doing with the civil service. You take a huge pool and create a risk pool, a medical risk pool. If you do that, we're going to accelerate the percentage of the people that can be able to access to healthcare. Yes.
And of course, there's the issue that Medicare in Kenya is really thought to be expensive as compared to other places like India and the like. How do we go about bringing the prices of first medical services, things like medicine, and even access down?
Again, there are many components that have been affecting our healthcare issues here. The underlying problem is corruption. Okay, the corruption, people have to understand that it is one of the biggest cancers that we have to get rid of, because all the middlemen, everything you want to do, something is padded together. The second thing I wanted to say is that if you look at the healthcare delivery and you take a cost, outpatient cost, 40% of that particular cost is drugs. 40 to 45%. Now, about 60% of the drugs we are using here are all imported. So, for example, at the moment when the shilling goes down against the dollar, you can see what the impact is in terms of the cost of healthcare. What India has done is to develop manufacturing capability and be able to lower the cost of healthcare, the drugs. That component that is so essential in healthcare delivery, which is the drugs. Kenya within the region has the highest percentage in terms of production of drugs, but still we are only managing about 40% from the local market.
Okay.
So what we need to do is, in my view, to lower the cost, we need to be able to bring in manufacturing of drugs. And although people talk about brand and generic,
yes,
most of India is generic. That's the way you bring the cost down. People associate generic to be a weaker drug, but what it only means is that generic is a drug that has been produced after the research was done. So you're not meeting the cost of the research. That's why you protect a drug because of the research, the patent, you call it a brand, and when that particular formula is allowed to be produced by other companies, then it is called a generic.
Okay, fine then. Thank you for coming inside and taking the time to talk to us. Thanks. And indeed giving us the brief on Medicare and health insurance. It has indeed been an engaging discussion.
Thank you very much.
Well, indeed, that is where we do bring it to a close today on KTN Financial Markets Live, an engaging discussion there on the government health benefits and the way forward to make these a reality. Do join us again later on this evening on KTN Business Today for more incisive look at business news, and at the same time tomorrow for more of the same. Do have yourselves a good afternoon. My name is Peter Wakaba.